friends, welcome to Therapy Thursdays on Louisiana Living. We are physical therapy and balance centers. I am Angela Yarborough and this is Dr. Jerry Yarborough. And what are we doing here? Well, we are talking about different disease processes, and we are just talking about different ailments, different things that keep you from loving your life. That is one of our mottos, is love your life. And we just wanted to give back to the community and just give you some things that you can do for some things that might be preventing you from loving your life. So why don't you tell us exactly what we're going to be doing?
All right. First, like I said, I'm Dr. Jerry Yarborough, physical therapist, and my sweet wife, Angela. By trade, she's actually a nurse. So, together, I opened the Jonesboro clinic about 20 years ago. I actually have about 27 years experience as a therapist. And then 7 years ago, we opened up here in Ruston. And just about 3 weeks ago, we opened up in Dorado, Arkansas now. So what we're doing, like she said, is we're talking about different diseases or impairments that are affecting your quality of life. And at Physical Therapy and Balance Centers, our desire is to help you love your life. So we're going to discuss those impairments. We're going to discuss how physical and occupational therapy can help you rehab from those impairments. And then we're going to always give you a takeaway of what you can start doing immediately to start making a change in your life and improving your quality of life. So again, come and see us every Thursday here on Louisiana Living. You can look us up on myarclemis.com or our personal Facebook page, physicalruston.com. Or you can even go to our Facebook page or even our YouTube channel. We have lots of videos and lots of education out there to help educate the community. Now, we want you to come back in the next two segments in which we'll start talking about certain ailments or impairments. And then, like I said, what physical and occupational therapy can help you overcome those impairments. And then again, we're always going to leave off with what you can do immediately to start helping improve your quality of life. So come back and see us and we'll get started. Thank you. Hey guys, welcome back. I'm Dr. Jerry Yarborough, physical therapist and owner of Physical Therapy and Balance Centers of Ruston and Jonesboro, Louisiana, and now even El Dorado, Arkansas. Today we have a special guest. This is Dr. Rachel Atkins, and she is one of our staff therapists here, and she specializes in pelvic floor impairments. Dr. Rachel?
Hi, thanks for having me today. I'd first like to just introduce the pelvic floor to you. This is a pelvic model. This is the back of the pelvis. This is the front, and this is the bottom, or what we call the pelvic floor, and it is primarily composed of muscles. And because it's soft tissue, it is easily susceptible to weakness, and that's what we're going to talk about today.
So, Dr. Rachel, what percentage of people are affected with pelvic floor impairments?
Well, the primary impairment that we see most patients for is incontinence. And about 50% of women over age 45 deal with incontinence, and about 2 out of 3 women over age 65 deal with incontinence, and about half that amount of men for both. So what we typically do is find out first what type of incontinence we're dealing with. There are 3 types of urinary incontinence. The first is urge incontinence, and that's where when you feel the urge to go, you just gotta go right then or you have an accident. The second type of incontinence is stress incontinence, and that is typically when you jump, sneeze, cough, laugh, lift, or change positions and you find yourself leaking. The third type of incontinence is mixed incontinence, which combines stress and urge together. So those are the 3 main types of incontinence that we typically see for people dealing with that weakness in the pelvic floor.
Okay, awesome. And so exactly which impairment are you going to be talking about today?
Today we're going to focus on stress incontinence, and that's what we'll be talking about in our next segment. So please stay tuned and join us to find out what you can do if you deal with stress incontinence, or leaking when lifting, laughing, jumping, etc.
All right, thank you guys. Come back in the next segment and you'll learn more from the very knowledgeable Dr. Rachel Atkins. So welcome back to Therapy Thursdays here on Louisiana Living. I'm Dr. Jerry Yarborough, owner of Fyzical Therapy and Balance Centers. And today we have a special guest speaker, Dr. Rachel Atkins. She's one of our staff therapists, and she is talking about pelvic floor impairments.
Yes, today we are specifically talking about incontinence and stress incontinence in particular right now. There's a myth involved with stress incontinence or urinary leakage associated with stressors like jumping, coughing, lifting, etc. And that myth is that you just need to perform Kegel exercises if you're leaking. But the truth is, first you need to find out why you're leaking when stressors occur. It can either be because your pelvic floor muscles are too tight or too loose. And so you really need to be evaluated by a pelvic floor therapist, which we're happy to help with, to find out first why the stressors are causing the urinary leakage. But I do want to give you one tip if you are having leakage with lifting, laughing, jumping, etc. And that tip is lifting without leaking. First, I'll just give you a brief illustration of how your abdominal cavity works. If you can imagine it as a balloon with your lungs at the top, abdominals at the front, pelvic floor muscles at the bottom, and your spine at the back. When you lift, pressure increases in this cavity, and pressure will go to the weakest area, which, if you are weak in the pelvic floor muscles, will cause urinary leakage. And so one way to lift without leaking is to exhale when you lift. When you exhale, pressure can go up into the lungs instead of down into the pelvic floor, causing leakage. So when you go to lift an item, grab it, use good body mechanics, and exhale as you lift. And that will help prevent leakage when lifting.
Awesome, thank you. That is one great technique you can start using today to help stop leakage as you try to move around. And remember what Dr. Rachel Atkins said, really if you're having an issue, you need to seek out skilled, trained assistance to help figure out what's going on. And here at Fyzical, we have Dr. Rachel, who is our specialist in this area. She can help you figure out what's wrong and help you learn how to resolve that issue to help you, again, remember to love your life. That's why we're here. Again, Dr. Jerry Yarborough at Fyzical Therapy and Balance Centers in Ruston and Jonesboro, Louisiana, and El Dorado, Arkansas. Y'all can look us up on myarclamist.com or physicalruston.com. Thanks, and come back again next week, in which Dr. Rachel will be talking more about pelvic floor impairments.